Hey guys, in just a minute you're going to see a really neat treatment that we've been doing in the office for decades for allergies, for chronic sinusitis, for ringing in the ears, for anything associated with brain fog, hormone headaches. It's really neat.
And we had a kind of unusual request, so Nicole came into the office and then she said, I want you to record the procedure so I can send it to my dad. So Nicole, tell everybody what is wrong, like what were you suffering from?
I have trouble with allergies, so then I end up with nasal polyps. And so Dr. J here does this wonderful thing called a sinus adjustment or endonasal, to where he goes up in and pops the polyps to where I can smell and taste for quite a while.
So she said, hey, I want to show it to my dad. He's having some sinus problems. And so we do the endonasal, where you literally take the sutures. There's a little tiny balloon. We'll show it to you in just a second. What it does is it gaps the sutures. It's really helpful for allergies. It helps with taste, helps with chronic headache problems. It really helps people to breathe. Up to do the endonasal, we do a blood pressure bulb, a sphygmomanometer. We hook it to a little bit of a finger cup, puts a little bit of a lotion on it. We take a blunt Q-tip, push it straight down into the nose, just a little bit, a couple pumps. And what it does is it makes those sutures gap, and it's just awesome for sinuses, for allergies, for ear problems, for taste, and for chronic hormonal headaches, because this can affect the pituitary gland. Okay, Nicole, take a deep breath in, open your mouth, stick out your tongue. Works a lot better if you do both sides, just not one, even though most people will say, you know, I don't breathe out of the right or I don't breathe out of the left. If you do it both sides, it works better, so let's do the other side. All right, Nicole, take a deep breath in, open your mouth, stick out your tongue. So that's the endonasal adjustment. It's been something that we've been doing in the office for about 70 years with really good outcomes, and as weird and as funky as it looks, it's one of the most requested procedures that we do, and I love doing it because it really helps people to achieve and maintain optimal health. So what was it that you just saw? Well, frequently people come in the office, they have postnasal drip, they've got chronic sinusitis, they've got allergies, basically they can have polyps, basically they cannot get oxygen into the system through the normal pathway, so they turn into a mouth breather. They can't breathe very well at night. And you know, oxygen is part of that three-legged stool for health. So you have good food, you have good water, and you have oxygen. I guess the fourth leg would be sleep. But if you have those, your outcomes for health are going to be really, really pretty good. So is there a different way to help enlarge the sinus tissue or open up those pathways, get, quote, a brain adjustment, unquote, or affect the pituitary gland, chronic earaches? And the answer is yes. And I was taught this through my father, who learned it from his dad. It's one of the neat things that we do in the office. So here's how you do the procedure. You have the patient lay flat on the table. You take a sphygmomanometer bulb or blood pressure cuff. You put a little finger cot around it, or a little dental plastic, half of the plastic finger. You tie it on really tight. You put a little bit of lubrication. I like to use either ultrasound gel or a little bit of liposomal glutathione. I think glutathione is really good for the nasal passages, but it does kind of smell just a little bit. So if people are sensitive to smells, any type of lubrication. You have the patient lay flat on your back. You take a blunt medical Q-tip and you gently push it straight down into the nose. You have the patient take a deep breath in and then open their mouth, which relaxes some of the cranial sutures. You do a quick couple of pumps and then you pull it out. It's important that you do both sides. Now, let's talk about the rationale behind doing it. There's a whole bunch of movable systems in your skull, and for years, and for almost forever, everybody thinks that those sutures don't move. But we know from research from John Upledger, who was a medical doctor at Michigan State, that he studied people that had passed away right after they passed away, and he looked at through electron analysis and some x-rays and some movable different types of imaging, and the cranial sutures in your head actually are like little zippers that come together, and they move. They're very small movements, like 1/1000th of an inch, but they move and they gap, and there's blood pressure, there's blood vessels, and there's nerves and those lymphatic fluids that are going through those connections. And if they get locked from either trauma or basically non-movement, what happens, it has an enormous influence on the body. It can affect neurotransmitters. It can affect cerebral spinal fluid. It can affect basically how you can breathe in and out of your nasal passage. It can cause earache problems. And so if you can release those, again, by doing that specific technique, when you blow up the balloon, what happens is you have, and I'm exaggerating, but you actually have those connections come apart. And as weird as it feels, people say it's like they're diving down into deep water, or they get pressure in their nose if they're underwater. It always has a tendency to make the eyes water. People ask if it hurts, and I always jokingly tell them, it doesn't hurt me at all. Thank you for asking. I'll be totally fine during the procedure. I know the patient's asking about them. It does have a tendency to make your eyes water for 3 to 5 seconds. Every once in a while, you'll get someone to have a real mild bloody nose because it can actually pop polyps and stuff. I've had that happen. I've seen my dad do it, where you put the balloon in the nose, you quick inflates, it pops the polyps. The testimony that you've seen that's actually on our video blog actually restores that patient's taste, and then they'll go for a time period. They have some allergies. The allergies build up, the polys build up. They can't taste anything. We do the procedure, their taste comes back on. Also in the video testimony, we'll talk about ringing of the ears. This is one of my favorite things to do for that tinnitus feeling, or that tinnitus sensation where the eardrums are hurt and they're buzzing and they hurt, and maybe it doesn't bother people so much during the day, but at night it really hurts their eardrums. If you do this endonasal, nasal specific adjustment that was taught to me by my grandfather to my dad, to me, it has an amazing ability to affect brain function, to help with ear conditions, to help with chronic sinusitis, postnasal drip, hormonal headaches. A lot of women that have headaches and increased acne during the hormone cycle. This does seem to affect the pituitary gland and reset that. And so for literally about any condition, if you go back in the Facebook archives, you'll actually see me practicing what I preach. And I just think it's a really good idea every once in a while to do a cranial adjustment.
Hey, thanks for watching the video. If you'd like more information, education, or want to work with us, head over to bestmedicaloptions.com. And if you want to help to reach, teach, and heal the world, leave a comment, share it with someone that you love. It may seem like an impossible task, but those that are crazy enough to think that they can change the world are the ones who do.